Drew, thank you so much for taking the time with me today to tell me about the work that you're doing at PayGround. I know that you are bringing, digital payment technology to healthcare, but it's about so much more than being able to pay for care with a credit card. Talk to me about the human toll of having outdated payment systems in healthcare.
Yeah, I think the best way to tell you that, Logan, is just through a quick personal story of mine. So a couple years ago, my family went through a couple big life events, as I think you know, but maybe the audience doesn't, so I'll just quickly go through it. My wife and I were having the birth of our third kiddo. His name's Augie. He's now 3, and we call him the master of disaster. And then I was diagnosed with testicular cancer. And between these seasons, we just were inundated with medical bills. And you don't have to have cancer, bring a baby home to really understand that the payment process in healthcare is not easy. It's wrought with friction. And so that was really the moment in which we said, let's turn the thing upside down. And so what we're doing, to your point, is offering patients a very easy and convenient way to pay all their medical bills in one place, which is through the PayGround mobile app. And they can do that now on the iOS and Android app stores.
Nice.
And so that's very different from what typically you might get a bill from one health system and then from a PCP or from a specialist, and it's all very different as far as paying that bill. We now offer, you can do it all in one place.
Why is it taking so long for healthcare to catch up? I mean, if I'm buying, fruit at the grocery store, I can use Apple Pay and just swipe my phone, and yet I'm getting paper bills from my doctor.
That's right. Yeah,
What gives?
I think it really speaks to the fragmentation in healthcare, and I think we got it right. I think in the last several years, we as an industry focused on the clinical interoperability, consolidating data so that people can make better decisions at the point of care. But now it's time to do the same thing on the revenue cycle, and that's what PayGround's here to do.
What are some of the downstream benefits to the providers to having better payments coming in?
Yeah, so when we came to market with PayGround, we knew that we just couldn't solve this friction point for consumers and not be able to reconcile this payment back to the providers in real time. And so for the providers, what PayGround offers is a very efficient way of allowing your patients to pay, but being able to opt into our network and connecting your billing system so that you can have your AR be reconciled in real time.
Okay. Do these providers end up collecting more? Is this, if you get paid quicker, do you get more in the end?
Yeah, that's another very good point that I should have brought up when you first asked me. So yes, they also get paid more. So one of the benefits of the PayGround solution is when providers opt into our platform and they start connecting their AR, we drop text and emails as soon as the claim gets adjudicated. And so we, on average, 60 days after go live, are improving collections close to 23%.
Wow.
And then we're decreasing DSO, the time it takes to pay, by over a full week.
I have to imagine that this plays into the physician burnout issue that we've heard so much about, and people leaving practice. I have to imagine that not getting paid on time, just struggling to pay your own bills because no one's paying you, feeds into that, do you think?
Yeah, I think so. I think that's why a lot of doctor groups have been willing to let go of their practice and have it be run by someone else, and they just treat patients. A tool like PayGround really provides them that modernized option that's easy to implement, low cost, so they can retain more autonomy in their practice.
Talk to me about your traction. How has this been received?
Yeah, so we started off in this area of the independent kind of ambulatory market. We're now in our second full year. Okay. And we're moving up market into the hospitals and health systems. Okay. So we've had some very strong traction in the ambulatory space, and we're looking to take that success story upstream into the hospitals and health systems.
What has that been like selling into these small, medium-sized clinics, now into the hospitals? What's their response like?
What really drives the adoption of our platform is the patient. So what's really taking us into the decision makers of hospital and health systems is their patients. And we, our home market is Phoenix, Arizona, and we've had strong adoption with our mobile app. And so now we're able to go to those health systems in our market and say, hey, tie in your AR to us. That patient is going to get a real real-time in-app notification or text message if they've opted into the PayGround platform for them to resolve any outstanding balance at those hospital sites.
So you said you're based in Phoenix. You got a sort of a strong anchor in Arizona.
That's right.
Does a company like this sort of necessarily have a regional component initially because you're selling into individual places? You got to go sell. Into those places.
I think the quick answer to that is we'll go anywhere. But we want to be thoughtful in our go-to-market approach, and so it's probably easy to turn to Uber and say, hey, we're taking the Uber model and taking a geographic approach to it, but we feel that's probably the right way to go about it. And so somebody calls us from a market we're not focused on, absolutely we'll say yes, and our platform will benefit them, improvement in collections, decrease in DSO, but we're really targeting the consumer marketing in specific markets.
You've had a lot of rapid growth over the last 2 years. It's been a big couple of years with PayGround. I know you left the corporate world, right, to start this company. So a big leap, probably with some uncertainty there.
That's right.
If you could go back in time and talk to yourself 2 years ago as you were starting this out, what are a couple things you might have said to yourself?
It wasn't going to be as quick as probably you would have hoped, and that is okay. I think you got to you build it right, and the rest will be take care of itself. But
and that's coming from someone who's seen a lot of growth in 2 years. Right?
It has. I mean, I think when we came to market with this solution, we knew that the market wanted it, right? But in the seasons of the last couple of years, as our society has faced, there was some uphill climb and some headwinds, and so a lot of that we took on the face. But we're excited of the growth potential here.
What was sort of the net of COVID on digital payments?
So everything went digital overnight, right?
Yeah.
It seemed, and so the more mature hospitals and health systems typically had this figured out. They had a modernized approach, digital first requests, but really the smaller practices didn't. And so it gave us an opportunity to really help those practices that maybe didn't even offer online payment. 1 in 3 medical doctors that are independent don't offer online payment today, and so we were really able to help those physicians out.
Well, Drew, I love what you're doing. Thanks for taking the time with me today. I love that you're, taking some of that burden off of patients who are just really anxious and stressed about these bills, and giving them the simplicity of knowing how to pay.
Thank you, Logan. It's a pleasure to be here as always.
All right.
Thanks.
Have a good one.